The Department of Psychiatry at the University of Buffalo has a long tradition of outstanding clinical care, excellent training, and innovative research.
We have 55 full-time faculty, 110 volunteer faculty, covering 4 large general hospitals and 2 children's hospitals. Our university is unique in its desire to foster collaborations between different disciplines and schools to develop truly novel approaches to disaster planning in particular. Regionally, we have established a network of university professors interested in studying disaster response, and our department has a leadership role in this effort as well. I'm currently president of that particular organization. We're using this type of collaboration to develop new ways of combating both natural and man-made disaster and models that can be applied to other places around the country and around the world.
The university also has a leadership role in addiction research.
One of the most innovative aspects of research in the department has been the interface between psychiatry and general medical practice. A number of years ago, we focused on helping mentally ill patients find primary care doctors. More recently, we've been working with pediatricians to improve their education and to provide backup and consultative services for them. We have a number of scientists who are outstanding in the field, including Dr. Dubovsky with his work on calcium ion channels in bipolar disorders, or Dr. Bruce Miller in his work with psychosomatic children, Dr. Betsy Wood in her work with families and psychosomatic disorders. The opportunity to work with these world-class researchers is an outstanding opportunity for young psychiatrists.
Excellence in research is just one of the reasons the University of Buffalo has been so successful in attracting residents in psychiatry.
For almost a quarter of a century, SUNY Buffalo has recruited between 8 to 12% of our graduates into psychiatry. This year, the national mean was 3.9%. We recruited 11% of the class of 2012. What's special about our psychiatric education is that we teach not only the neuroscience of psychiatric illness, but we use a humanistic approach that employs music, literature, and art to capture the self-experience of illness, what it feels like to have psychiatric disorders.
We've been very successful in recruiting a very broad range of residents who are academically oriented. Our faculty is dynamic and engaging, and the residents are able to work with them on different clinical projects and research projects. We have a medical educator track, and this allows residents to enhance their skills as clinical educators. We also have a research track where several residents have participated, and they devote a large amount of their time, especially in their 3rd and their 4th year, to research.
When new opportunities come to light about either curriculum development or new patient care initiatives, the department always takes into consideration how to incorporate the residents into those endeavors.
One of the greatest things about Buffalo is the fact that we have a really wonderful university, right? Very accessible to us. We have great access between different hospitals. We have collaboration between different health systems. Buffalo is also wonderful because it's a city with a small town feel. It's very friendly and incredibly affordable. We have wonderful cultural opportunities here as well. It's a rich place to live and work.
The department sponsors an annual comprehensive review of psychiatry programs at Niagara Falls that attracts speakers and attendees from around the world. There are also opportunities for residents and faculty to develop new types of models of care delivery and redesign services in the region.
Well, the Division of Community Psychiatry is actively engaged with community agencies, both from a clinical standpoint, but also from an advocacy standpoint, trying to figure out how to individualize care for the various populations that we treat. From the political standpoint, we work very closely at the county level with the commissioners of all the major departments, as well as at the state level, both in writing bills that are currently in the New York State Assembly and Senate, as well as providing educational opportunities for various members who work within the state level of government. There's really 3 active pilot projects that we're working on right now. 2 in the world of forensic psychiatry, looking at high utilizers of the adult forensic system as well as the child forensic system, and how psychiatric interventions can decrease their need for involvement with law enforcement, and then in the case of children, hopefully improve their long-term developmental trajectory so that they don't further penetrate the system. Working in Western New York and the Buffalo area psychiatrically is challenging but extremely rewarding. We've really been welcomed in and been able to actively create leadership positions and really start to affect the way behavioral health is delivered within Western New York.
My vision for the Department of Psychiatry is to see it continue to grow as a national and international leader in psychiatric education and in the development of novel psychiatric therapies, ways of diagnosing psychiatric illness, and ways of integrating basic science and clinical information to provide the highest level of care that anyone can provide.